Have you ever gone into any of the study patient charts and written entries and dated them for dates before the date you were making the writing?
Would you please repeat your question?
Yes. Did you ever take any patient charts and go back to those charts and write an entry and indicate that the entry had been made at a previous date when in fact you had just done it at that time?
You mean to enter inside the chart in a different time?
Yes.
Yeah, it can happen.
Do you recall, well, let's call that backdating. Like, for example, today I might go into a chart and write a notation and put the date of back in time.
Yes.
Yesterday or some other time. It was backdating.
Right.
Okay. Did you ever do that regarding any of these charts in the USC study?
I don't remember, but it can happen.
How can that happen?
Sometimes we ask the students to leave room, and if they do, we go back and fill the space. Sometimes they ask, how much space do you need? I can ask 2-3 lines. It can happen.
Then later you'll go back and fill in that space?
Yes.
Okay. How much time would be involved in something like that? In other words, a few days you might go back, a week? How far into the future might you go and then come back to write something?
I really don't know.
Could it be more than 6 months?
I would be surprised.
What's the longest length of time that you might expect that you might actually go back and write something in a space that had been left open in a chart?
Maybe a few weeks, few months, but really I would be surprised.
You would say a few months would be the maximum time?
Yes.
And under what circumstances would that happen, where you might ask someone to leave some space and then go back and fill it in later?
As I told you, we are a teaching institute, and many times, at the same time, many people, they need the chart. And the patient is just had the surgery, for example. Now is going to be treated by somebody else, and then is going to be examined by a radiologist, and everybody needs the chart. And it's not really unusual. It's not unusual.